Hello, these are my slides for our clinic presentation. So I'll be starting off by talking about our integration of our group. We were split into two groups from our year group, one of which did first 6 weeks of clinic and the next group did the second 6 weeks. And this was quite nice really because it meant we got to have a bit of a break. So we knew that the first 6 weeks our group were in the clinic, which meant late nights, but they were enjoyable. And then the second lot meant that we had a bit of a break. So working as part of a smaller group, this allowed us to get to know more of our cohort. We were able to organise everybody a little bit better, from anybody needing time off because of sick or childcare or not being able to attend. We were able to jiggle things about quite nicely. Our group were quite versatile and very supportive with whatever we did really. We all worked very well together. The organisation that we all had very different strengths, but we pulled together and it meant that we were able to fully work as a team as you would in a professional setting. The group that we were in, we had a lot of laughter, a lot of giggles, but we were very geared up to looking after our clients, and it was nice to have different strengths of therapists in our group, which allowed us to pull on those strengths. So Paul is quite good with his manipulation, particularly with Joe's type of massage. So then if there was something that we were a little bit unsure of, Paul was very good at sort of, well, try this technique for this client. And then there was others that might be a little bit better or have a little bit stronger confidences in aromatherapy. So we were able to just pick on each other's strengths to be able to give our clients a really enjoyable experience and to make the most of our experience running our evening clinic. So this was very good for all of us, I think. As they say on the slides, each point was very helpful for all of us. We each gained self-confidence in not only our therapies that we provide, but also having the different setting without the lecturers, without a big group of people in the clinic. We were able to have a smaller, more relaxed environment, and we were able to provide a professional, clinical treatments to our patients and clients, and they were more than happy to come back each week. In fact, I think a lot of them they like coming back each year. So year twos, you'll have lots of people to practice on. As I said in the previous slide, teamwork, we worked really well together as a team. We were able to manage the books, any bookings, any cancellations. If there was cancellations and somebody needed to be somewhere, then we would move everybody around so that they could either go home or they could be where they needed to be, and we would take charge of what needs to be done. In improving our communication skills, I think throughout this whole process we have all learned to communicate a lot better, not with just our skills, our therapies, but understanding what patients and what clients need from us. So being able to annotate what we need to do to them in professional manners, but knowing what we're talking about, I think is really promising for not just us, but for the clients that we treat. Timekeeping, I think we were all really, really on it. We took our clients in on time, and sometimes it was a little bit hard to keep them to time because the clients are so much enjoying their treatment and their time with us, and you form that bond with them because you're seeing them week in, week out for 6 weeks. They become very much a part of you, and you get to know a little bit about them and what they do. And most of them work on the university campus, so they're very busy people, so they quite enjoy coming to us to have that 5 minutes self-care time. So timekeeping was good, because a lot of times, particularly one lady that I treated, she would come to us straight from work, which meant sometimes, depending on what she was doing, she would be a little bit late, which would obviously then have a bit of an impact on the treatment time. But by doing the thorough consultation during week 1, she was able to come straight in. We knew what we were doing. We had a bit of a plan of where we were going forward. So she was able to come in and have all of her time dedicated to hands-on treatment. And then we would go through her aftercare. So timekeeping and time management was a learning curve for all of us, but also knowing what it's like in the real world with people finishing work and rushing to you for their treatments. Everybody enjoyed their treatments. Money taken, we handled the money, but a lot of people would pay right up front. So during the first week of them having their treatments, they would pay their bulk, and we wouldn't have to handle any more money then for the rest of the 6 weeks. However, there were some people that would pay weekly, which was fine, and everything is always in the Martin's room, labelled. And once we sort of got into the swing of it, I think we were all very good at it. And we would take for our own clients' treatments, but then we would always go through it at the end to make sure that each of our clients that we'd had paid or had been sorted. If there was something missing in the book, we would just confirm with the other therapist that they had sorted that out. We worked to get well as a team. Our techniques, this was a really good opportunity for us to practice our advanced practice massage, because you don't get much hands-on experience with the advanced practice because of the time frame that we get with Jo. Having that clinic experience straight from her lectures allowed us to put into practice what we had just learned, and it was really nice to use some different techniques on clients and really see the benefits of those further techniques have a lasting effect weekly for our clients that we would see. Limitations for the clinic. They wouldn't say there's very many limitations other than what's on the screen, really. Martin, he was a massive help, and I think we run him ragged most week with making sure that we had everything, and if we didn't have anything, he would get it. But it did provide us with some things that maybe we wish that we could have done, which was if our clients were late or had cancelled, that having the opportunity to be able to phone them, whereas Martin's very hands-on and he is very good, and he would kind of do that just to sort of make it a little bit easier for us. But I think having that experience of dealing with people and taking cancellations and trying to phone round to make other appointments, I think would be a good moving forward point for next year's students. Fatigue, again, when you're in lecture all day from 9 in the morning, plus earlier if you've got children to get up and get to school, the evening clinics are long. Even though we did make them enjoyable and we did make the most out of it, I think we're very grateful of our cup of coffee and quick 5-minute break before we got into clinic. But it is a very long day till 7:15, particularly if you've got a client that cancels your first client cancels and you're kind of waiting around a little bit to your next client. But taking your laptop in, doing a little bit of studying, or being able to go and sit in the library and utilising your time wisely if another client can't be booked in. Moving on to noise, because we work in cubicles with curtains, they're not doors. We can't completely block out all sounds, and I think sometimes clients themselves can be a little bit loud talking, particularly when they're going through consultations. And we've had a few incidences where clients would forget that there's not walls between them and they're going through their consultation and everybody can hear them. But having gentle words with those clients just to say, look, there are other clients that are around that are trying to relax. Just be a little bit mindful and gauging it yourself, because you don't want to be rude. You don't want to not have them talk to you, because they clearly want to talk to you, and they feel that as therapists they can talk to us. But having those moments where maybe you're talking at the beginning of a treatment, and then, right, I'm just going to stop a second, we're just going to take some deep breaths. By saying to your client, taking some deep breaths and just focusing on your breathing, it's almost like an unofficial way of saying, right, come on then, we're going to be quiet now, and we're just going to focus on getting you nice and relaxed. And I think as we got to know our clients, they were more relaxing into their treatments and forgetting to talk to us. But there is the odd one or two that can be quite loud, and you need to sort of get them to be mindful of other people.